Menopause Diva is a page that I started after my menopause transition. It was debilitating. It wasn't easy for me. All the symptoms hit me like an avalanche or a tsunami. And I just thought to myself, I would do something about this. I would talk about menopause when I start feeling better. Because I tried to talk to people and nobody really was saying anything. Nobody wanted to say anything about menopause. They thought, oh, you don't have to let the world know that you're aging. But I've come to realize that there is nothing wrong with aging, neither is there anything wrong with menopause. Menopause is a natural occurrence. Menopause is something every woman will go through. And we should be able to talk about it freely. Because I know that when you talk about something, you feel better. And of course, when you don't talk about something, you think you're the only person going through it, because I thought I was the only person going through it and I thought I was dying. But so here we are today in our third conversation. So that's the reason why I started this page, to help other women, to create an environment where women can talk about what they're going through, to create an environment where women can support each other. So nothing is not a taboo. We can discuss it freely, and even at the workplace, to be able to create an awareness of menopause everywhere, from the educational sector to the health sector, so that people are aware what women go through as they age in life. So that's the reason for all this. And the first conversation we had was menopause whilst Black, the Black woman and menopause, and how we don't talk about these things. And then the second conversation we had was with Ms. Fumi Fatusin, and we talked about speaking out, that it helps to speak out. When you speak out, people can help you. But anything you don't talk about, anything people don't know you're going through, how will they help you? And when you talk about it, you get other people's perspective, you get some knowledge. So today, the conversation is on all things menopause from the medical perspective, because I am not a doctor. I actually had to tell someone the other day, I am not a doctor. I probably will be considered a patient expert or something like that. And I thought, I get to have lots of questions in my DM. What do you do? How did you get to this point that you feel good, you feel better? What can we do? What supplements do we take? What lifestyle changes, and all of that. So I thought it would be good to bring in a doctor to speak to us. And who better than the brilliant, knowledgeable, funny Dr. Oshinowo? He's just the best person to speak to this topic. So I thought to bring him in today. And Dr. Oshinowo is the consultant, is a consultant at Premier, and I'm a consultant obstetrician and a gynecologist, co-founder and partner at the Premier Specialist Medical Center, Victoria Island, Lagos, Nigeria, since September 1992. Dr. Oshinowo is my doctor. He, as far as I'm concerned, is one of the best doctors we have in Nigeria. And so we can't say with a loud applause, but we can say with lots of waves, because there is a sign there where you can wave with lots of waves. I would like you to make welcome the special guest speaker for today, Dr. Omololu Oshinowo, as he speaks on the subject, all things menopause, the medical perspective. At this time, I would ask all participants to please mute your microphones. The chat room is there. You can send in your questions, put your comments. If something rings a bell, if something hits home, just put the comments right there in the chat room. And we're collecting the questions. I know some of you sent in questions when you registered. We have all of those questions, and the doctor will speak to those issues. Also, I would want you to prepare your questions. We will have a session for questions and answers. Doctor will first talk about menopause, all things menopause, and then we will take questions. Okay, Dr. Oshinowo, sir, can you please start? Thank you.
Yeah, good afternoon, everybody. I know you are all muted. When I was asked to talk about this topic, I was told you've been having some sessions about it. And my reaction is, it's very likely somebody's been talking about the diagnosis of menopause to you. And I decided that I will go through it by starting some aspect of the end of it. Because I know that some people might not be able to join this Zoom meeting on time. So by the time they join late, they will have some aspects. And of course, there's going to be a session for questioning. The time is very short. I'll try and go fast on the slide I provided. Can I have the slides, please?
You have a slide, sir?
Yes, okay then. The first slide you see on the screen is what will you understand and what you will understand at the end of this discussion. Because we will talk about the cause and effects of the signs and symptoms of the menopause. What I mean by that is the way you feel and what you notice. And one of them is your regular menstrual cycles, what happens to it. I will talk more about that later. And then the second one you want to go away with that you will understand after the discussion is the diverse array of stressful events that happen to you around this period. Some of these events can really cause crisis. I mean, this can be some things that you could take normally when you were having your normal cycle and everything, and because of the changes that your body perceive during this pre-menopause area, you can really have crisis. For example, let me just tell you one that might interest you. What you take from your spouse might now start becoming a problem, and you start reacting without thinking of the side effects. You just suddenly start having what feels like short fuses for what that doesn't matter, and most of the time you regret your action. And then another thing you need to go away with is the importance of self-care, because most women at this stage of their life don't even think about themselves. For a lot of them, they're still looking after the children. And some of them, for a reason or the other, have gone past the children. They started worrying about grandchildren. But you now find out that things that never used to be a problem because you felt tired at night and you sleep, and then sleep starts becoming a problem. And then, of course, you are careless about your health. You don't check your health. You check everybody's health. You feel for everybody, oh, you are not feeling well today. Why are you not eating well today? You say to everybody, you never care about yourself. You need to go away with that. And of course, the food you eat, the type of exercise you do, because you get tired, but then life must continue, and a lot of lifestyle changes. You will need to understand that. Can I have the second slide? Of course, from what I said earlier, a lot of things that now happen to you are changes associated with the menopause. I would say this without jumping to the conclusion. Menopause is actually cessation of regular menstrual periods. But there are things that I call signs and symptoms earlier on that happened before that last bit of no period. But if I can digress a bit, in a woman's life, when you start your period, they call it menarche, and that is associated with what we generally call puberty. The first period is called menarche, and that changes, means you either have regular periods once every month, or in some people, it doesn't come regularly till you stop at the end of your menstrual life, and that is menopause. And then, of course, related health issue and cancer fears, because people start having real cancer fear around this time, because a lot of people feel when they start having the perimenopausal symptoms, which means the bleeding might start getting irregular and things like that, anything that is out of normal, you always think of the worst. Do I have cancer? And of course, at this stage, people are very afraid. They don't want to talk. They don't want to appear to be a nuisance to the husband or the family, that you're always talking of the worst of yourself. That you will go through. And then, of course, we need to know about the cause of the symptoms. And that's how you feel when you go through menopause. Then you will think of the solution. How do I come out of all this problem? There are non-hormonal solutions, because you see, the hormonal solution, if I talk about it, I think I might be able to convince people today, because that is always a Herculean task, talking to an average Nigerian woman about the need to help with some hormonal solution. And then your lifestyle modification, I've said that, and then the gut health repair. And that is because with part of the problems you have during menopause is your eating habits. Of course, most of the time when your sleeping habit changes, your eating habit changes, but then you need to try and correct that. Can I have the next one, please? We try and go fast through it. Next one, please. What you will be able to do at the end of the day, you'll be able to allay the health fears and cancer scares, modify certain risk factors, be in control, prevent and treat some of the symptoms. You sleep better, look good, and feel good, because you see, not looking good, losing self-esteem and things like that, all come from the mind. And when you work on it, you know that you are able to do something about it. And then you save yourself unnecessary costs, tests, hospital visits, emergencies, and things like that, and even false accusation of the evil people, your enemies, your perceived enemies, that's just in your imagination. So because once you know what is happening, then you know what's going on. Because I always tell people, in medical management, anywhere in the world, once you have a diagnosis, then you have virtually completed the treatment of that patient. What I mean by that statement is, if you have malaria, 1,001 things can give you fever. If the diagnosis of the malaria is effectively made, then you have solved that problem. If you don't make the diagnosis accurately, you will end up treating all sorts of irrelevant things, and it might take you a long time before you realize that you've been making mistakes. Can I have the next slide, please? Well, this thing is about midlife. I mean, if you take the average lifespan of in Nigeria now from what they said, I mean, I feel they were saying 65 and maybe 75. Well, with what is happening in the world now, I don't know how low it's going to be. But you see, we also call it perimenopause. Perimenopause in the sense that, like I told you earlier, you don't have to stop the bleeding aspects of the period before you know that you are going through a change. Because some people will have been noticing certain things have been happening to them. And that's when the curiosity will have started. And then you start looking at people. And then for some of the people, the hot flushes that is normally described now start hitting them. And that's when they now think, oh, come to think of it, I have heard about this thing before. They say when you don't have periods. Meanwhile, they'll be able to think back and now notice that a lot of things have started happening to them. I talked about being short-fused. People will have realized they were shouting any little thing. What whatever the kids do, or even the grandchildren do, I mean, these are people you really love. You start screaming at them. And then some of the smart grandchildren nowadays will say, "Grandma, you never used to be like this. What's going on, Grandma?" And that's when you realize that, oh, there's something actually wrong with me. And of course, diverse area of stressful events like I talked about. I mean, noticing, even merely being invited to parties sometimes, you could just start getting stressed about what doesn't concern you. You're not the one doing, hosting the event. Then it now start becoming your problem. These are things that with time you notice that, oh, perhaps I am getting the so-called perimenopausal symptoms. And of course, a lot of things affect it. Age, the genes, it runs in some families. Some mothers will tell their daughters that, oh, you're still having your period at 52. Oh, my grandmother stopped at 56. Never mind, they might not really know the age of the grandmother, but it's the sort of thing that runs in the family. And of course, there is a condition that is very abnormal. I mean, you cannot really claim that runs in family. And when the menopause starts at a very young age, I will talk about that in the next few slides, because there is an age range to menopause, but it can happen very early. And when it happens early, that one is called premature menopause, okay? And then, of course, the common complaints is, I don't seem to be sleeping well. And of course, we all know that if you're not sleeping one night, it's a one-off thing, then you are all right. But by the time you are doing a week, 2 weeks, 3 weeks of not sleeping, then your pattern changes. A lot of things come with sleep. I will talk about that later. There are some hormones and secretions that happen in your body. Your body has a biological timing. When you are supposed to calm down and sleep, everything else will sleep with you. But if you don't sleep, all the other things are working. And then when you are supposed to wake up and walk around, and whatever you are supposed to produce is being produced at the wrong time, it really affects. It affects your mood. It makes you fatigue because you feel tired. You can't get up and go. And of course, you will have the transition, and then what comes out of it, your evolving self, and what you've gained by knowing what's going with you. Remember I said, medical condition is about proper diagnosis, because I want to believe that a lot of us will go away from this Zoom meeting knowing what's likely to be happening, and knowing that I'm not alone, knowing that no babalawo is after me, knowing that no mother-in-law is after me, that this thing happens. And of course, if you're very close to your mother-in-law and you talk to your mother-in-law, she will tell you it's not a big deal. They went through it too. People were not talking about it in this country many years ago because the knowledge and the treatments and the diagnosis, they were there, but people were not ready to listen. We are getting this now because of the level of education and level of exposure of an average Nigerian. Can I have the next slide, please? And then, of course, some of the stressors that you have that would be a problem is the health concern, like I said, death, sudden death in the family, and losses in the family. Relationship, I've talked about that. The partner, that seems to be a big one. Even somebody that you trusted absolutely, then you start worrying about him. And then maybe the person had been coming late or is always chasing. Because at this stage, for a lot of family, I must say, the children are likely to be going to tertiary institutions, and some of them are going to be going out of this country to work abroad. And of course, the owners, majorly, because I know nowadays there's always cooperation between spouses, is on the man. And of course, most men don't talk. they go out and look for this money. And in the attempts to do that, they get the wrath of a woman going through menopausal symptoms, and it causes a lot of argument. This is the stage that you need each other's encouragement and understanding. Of course, you worry about your parents. And I think most of the people I'm talking to today are the lost generation. I might still be involved in that lost generation. What I mean by that is this generation worry about their parents and worry about their children. And I'm sorry to say, for most of us, the children we are bringing up now worry less about us. They talk about it. And whether we like it or not, the only thing you can do to hold on to them is whatever you give them by way of training and what they see as what is the need to me at the end of the day. But worrying about them, you cannot stop. Because you see, a lot of people see children at this age as an investment. But then let me just tell you, this is investment that you can never gain from. Because you are not going to, even if they have the money, they won't just give it. They will buy things for you, but it's not like you've spent money on them, you return. That's the way you felt about your parents. That is just unfortunate, and that's what life is. It happens all over the world. And then, of course, a little thing, minor things, nebulous things make you emotionally wounded. That is overreaction, okay? And of course, work issue. People are getting, on the average, by the time you go through menopause and you're going to do, you're working, you're a civil servant and things like that, you start thinking, oh, you have maybe about 10 years or around that to retire, or have you achieved your goal? Have you got enough that you need to live on? Because by then, you started hearing about retirees, I mean, the people, the pension not being paid, and people going to wait for pension all the time, all day, and then no money is paid. And then you start wondering and worrying, will this happen to me? The way you could have thought about it, if not for the fact of the changes in your body, you would have taken it and said, okay, fine. I mean, once there's life, there's hope. You get on with your life, but you make it a big burden to yourself. Of course, the finance. And of course, at this stage, that we see some few people that are still looking for the so-called fruit of the womb. And that will be a problem. And those days, many years ago, before the advent of IVF, a lot of people will think, oh, well, this is not possible again. Your eggs are not going to work and things like that. But then nowadays, through IVF, one way or the other, we have known old people carrying pregnancies. In fact, I'm sure we are all aware of the 67-year-old Italian, even in Abeokuta recently, somebody over 60 that carried a baby successfully. So life has changed. This is what you didn't have about 40 years ago. In fact, it was never a dream to the whole world before Louis Brown was born in the mid-England. Okay, can I have the next one? Of course, thinking of having children and then your stress hormone and things like that. Okay, we will now go to the topic, menopause. The average age of menopause is, let me put it like this, we say 50 plus or minus 2 years, which means about age 48 to 52. The problem is if you don't stop at 52, it might not be worrisome, but if it continues, then the thoughts by the doctor or people seeing you is at that age, if you continue to have your period at 52, 53, 54, because it's not common, then you might be thinking of some other possible problems. And especially for people who have phobia for cancer, the phobia is even more worrisome at old age before you get to menopause. If you have it before 48, because you can have it between 45, 48 and things like that, it might still be normal. But by the time you are having it at 40, then that qualifies you for having premature menopause. Despite the age expectation, when menopause comes, there's still a lot of life to a lot of people. And that's why some women, from the time they stop their period, they have an average of 30 years to live, or more than that. So you can imagine the ovaries that were working towards making sure that the lining of the womb is stimulated and then you bleed from the womb every month are still there, and there are potential problems because nature can make them wake up one day and they start doing whatever they are not supposed to do, and then there could be a problem. What I'm trying to say with this is if you have not had your period at menopause for 12 months and then you have any form of bleeding per vagina, it's termed postmenopausal bleeding, and that needs to be effectively treated, investigated by your gynecologist because there might be a problem, okay? And the changes that you have during menopause, I've talked about that. A lot of people see it as illness. Of course, when you're having hot flushes that you never had before, you probably first think you have malaria, and that's when, and then it's so strange because you are staying in the room when everybody is very comfortable, the air conditioner is on, and then suddenly you are asking for a hand fan, or you go and say, oh, can you put on that standing fan for me? You stand in front of it, and then people will be looking at you. Of course, people older than you will understand. They'll be giggling. Okay, well, welcome to the world. But then the men and the young people in that place, we thought that we were strange. Or sometimes in the nights, you were asleep, you cover yourself because the room is particularly cold. You're under the duvet, and suddenly you have to pull the duvet off, sweating. In fact, the sweat sometimes can be so heavy that you actually drench the bed sheets, wondering what's going on. So those are the things you notice. And of course, your physical, emotional, social, because you go off, you don't want to go out as much as you're going because you think this problem, in fact, you know the unfortunate thing, because you don't know what the cause of this problem is, it takes you out of circulation because you feel whatever it is, and that's where people now start thinking of all sort of things. If you have somebody who talk to you anyhow, you quickly think, oh, perhaps that's the cause of your problem. And in fact, if for any reason somebody had an argument with you and said things that could normally look like shakara to people, you will take it very serious. All these things happen. And then I want to believe that if you hear about these things today, you start changing your mind about your jumping into conclusions with most things that happen to you. Can I have the next one, please? Yes, and then you see, continuing with the menopause, you see, the reaction, the way people feel is very unique to individual. It is very, very unique to individual. You see, some people hardly notice it. And that's why when you talk to some people of that age, they will tell you, oh, they don't know what's so-called. It's not as if they are denying it. And of course, a lot of people, and that's where some other factors will come in. Some people are naturally endowed because when I will say this, and I will explain it when I get to you later, the menopause problem surrounds one major factor, and that is estrogen production. Estrogen is produced mainly from the ovaries, but then in some people, it can be, in fact, in people, it can be produced somewhere else. And this is known to be common in adipose tissue, and that's fat tissues. And that's why a lot of people who are fat are less likely to complain about those symptoms, because once the ovaries go to sleep, they have some other sources of estrogen, but it's never enough. And that's why people vary in the way that they express the altering effects of the menopause. And of course, it's taking antidepressant for being depressed is not the answer, because see, it's like taking Panadol for headache and not trying to look for the cause of the headache. You're just wasting your time. Because when you take the antidepressant, when the drug is working, then you feel better. And then once the effect of the drug goes, and then you are in trouble. You are back to yourself. And then you find the knowledge and empower yourself. Major effect due to weak, thin, fragile bone, muscle ache, and the effect of the hormone on the mucous membrane. Can I have the next one? I might be able to say more on that. Okay, I have, if we go together on these, can you see my marker on the map? Can just wave if you can see my marker on the, okay, well, I'll just talk about it. Like I said, changes, the first major one is mood swings, anxiety, panic attacks, depression. Then you have irritability, inability to sleep, forgetfulness. Your forgetfulness sometimes could be about short amnesia. It's like you're cooking in the kitchen, you felt you want to take this plate of half-fried meat to the table, and then you went to the table, and then you get to the table and say, okay, fine, okay, I was coming here, I was holding on to a pan of fried meat, where is it? And then you'll be looking for it, and you don't know where. Sometimes you are with your telephone, and then you start looking for it. Or you have your glasses on, you want your glasses again to see properly until you touch your face, and then you find out the glasses is there. These are very short things. It happens, and it gets very common at that stage. When it happens, you might feel, oh yes, it's a one-off thing, and it gets constant. You want to take your child out, and you are in the car, you drive off to realize that, oh, the child is not in the car, or the grandchild, by the way, at this age. So these are things you notice. And of course, dizzy spells, okay? Racing thoughts, you are just going from one to the other, you panic and things like that. In fact, you make what are not your problems. You become talkative. You make everybody's problem your problem. And then you start making judgments when you are not asked to be. And then, of course, you cannot concentrate. You cannot concentrate. And that's when even where your concentration can go from most things, even watching a normal Nollywood movie, you get up, you go to the kitchen and things like that. And then, of course, you will do everything except sleep, because you can't sleep. You are afraid of sleep. So these are things that happen. In fact, most at this stage, when you realize you are afraid of night, just realize you are starting to have dental problems. That's when you start having, you like eating groundnuts, and then suddenly you hurt, and then you start feeling sensation. You see your dentist, they said there's a crack there. And of course, it's either you do the expensive root canal or implant, or you take it out. These are things that happen due to some changes your body is going through. Metallic taste in your mouth, dry mouth and throat. You want to sip water all the time. Burning mouth sensation, heartburns, and bloating. You feel bloated. because you retain fluid. You have the diarrhea, going from diarrhea to constipation, and that's why I said sometimes you will need to learn on what to eat so that you can prevent, because by then you will quickly know what is good for you and what is not good for you. For example, you could end up with beans from the family, that, oh, in your family you eat a lot of beans, and then suddenly you find out that you eat beans, you go to toilet frequently. And you first be thinking that you have infection, food poisoning, and things like that, to realize that, oh, it's your habit, is the food you eat. Because the lining of the intestine is changed. Because these menopausal problems affect almost, from the picture I showed, almost every organ of your body. Cramps, mouth odor, and food sensitivities. You suddenly find out that some food that you used to eat without a problem is now becoming a problem for you. It's better you know what is good for you and what is not good for you. You leave it. Okay, can I have the next one, please? Yes, poor blood glucose control, dry eyes, itchy skin. What I mean by poor blood glucose control is you normally have the insulin trying to control your glucose, and then you now find out that even when people are diabetic at that age, they are likely for some of them to be told that they have insulin resistant the glucose control. So this thing does happen, and it's because with all that, there's estrogen production involved in the metabolism of the glucose initially. Then you feel crawly, skinny sensation, because sometimes when you go to some doctors who are not quick in trying to figure out what is happening, and you say, doctor, I feel there's something crawling under my skin. And the person will look at you. Of course, the good Lord has given us all our minds. The doctor might be looking at you and then be thinking of, oh, am I sure this woman is now not going around the bend? Of course, I mean, when you say something is crawling under your skin, I mean, you can't see it. It's not like headworm or an insect walking, but you can feel the sensation. The doctor can't see it. So the doctor might think it's more than that. So, but it does happen if the doctor knows that, oh, these are things related to menopause. And then, of course, occasionally you have some dark areas on the skin, and then you change in some your body odor, especially your armpits, and of course the vagina, because I will talk about that, because most of the, I want to believe that I'm still within time. The host, can you just let me know?
Yes, yes, you are.
Okay then, okay. And the body odor, and then of course the chin and facial hair. This is very common, because I'm sure we have all seen some women, I would say especially very old women. When I say very old, maybe in the late 70s and 80s, when you look at them, they almost have what men have by way of mustache and beard. And these are all due to some hormonal changes that I will describe later when we get to it. Can I have the next one? Of course, we are getting home, because I'm sure we are getting to where a lot of people have always wondered about, okay? Lifelong issue, complex, contextual, subjective, with layered of problems, low libido or sex drive, inability to reach orgasm. For people who felt anytime they make love with their spouse, that will be the end of the show. That doesn't come again. Reduced response to sexual stimulation. And of course, not enough natural lubrication for sex. This is a very major one. And of course, is the same reason for the next one, uncomfortable or painful sex. When you think of these two, then you can work your way back to the beginning. Of course, if the last time you made love with your spouse, you ended up suffering for 12 hours or 24 hours after, of course you will lose interest. And then of course, if you have pain, there's no time for orgasm. And if you know pain is going to come, your libido will drop. And what causes all this is the effect of the lack of estrogen that helps the texture of the vagina, the glands on the vaginal wall, the glands on the cervix, to give you the lubricant, the natural lubricant that you use during making love. Of course, if there's no pain, then all the others will follow. And of course, the barriers now started getting psychological. Of course, it's physiological. And of course, people will now think it's spiritual. Of course, a lot of people will feel, oh, maybe the God doesn't want us to do this again. Okay, let me just continue and pray, doing what I know best, being spiritual. For some women, can this move up and be up a bit? There's somebody under, okay. For some women, because this is very important, the libido increases. And in such women, they are far in between, they are few. If you remember earlier, I talked about the old women who have mustache and beard. This is due to the fact that there is a certain sex hormone, the testosterone, that is commoner in men. Because all hormones that we talk about in human beings, we have both male and female having it. It's just that the levels of each hormone varies and they have ranges for men and women. The testosterone is normally very high in men, low in women, but towards the end and after menopause in some women or perimenopausal, the testosterone increases in women, and those are likely to be the women whose libido increase. Because if there's a drive for it, it doesn't matter, they might still feel dry, they are able to discountenance the pain that comes with it. And that we explain that in a lot of people. Can I have the next one, please? And then you see what you need to do is you need to find your own comfort place. You need to break the barrier, find out what you need to do about it, and then especially when it comes to making love, if you know you are dry, and then of course at the beginning of making love, it's enjoyable, and then in no time, because there's no natural lubricant, you are going to be dry and then it's going to end up being painful, then there are things you can do. You can use lubricants. There are different types that you need to use. And you need to, because you see, people use all sort of things. You don't want to use what will get you into trouble after, because they do all sorts. But I can say this openly now, you are better off with water-based lubricants, because they don't cause mess and they don't cause reaction, okay? And of course, there are some benefits of sex that we all know of. I mean, when you're younger, you know it is. You burn calories easily. It aids your sleep, because if you are able to enjoy it, you sleep after. Because jokingly, it's said that making love is about doing 18 miles marathon, and it's a joke because people sleep like log of wood after, and it releases endorphins. It's like doing exercise. It releases, and then your body calm down after. It may lower your high blood pressure, and then reduce the risk of heart attack, and it prevents disuse atrophy. Disuse atrophy in the sense that if there's any part of your body, your muscle, your legs, and things like that, that you don't use, then it weakens up, because that part of the body needs to be exercised regularly. Okay, the lifestyle factors include nutritional support, herbal support for sex function. That honestly, I feel is not fair. It's not very helpful because you never know what these people put inside. But then occasionally there are some drugs that are proven that women can use, like men using it. So it might help. But you don't want to quickly go into that. You want to see what happens before you do that. You want to try natural means first. Of course, the last thing is seek help. Talk to someone, because most of the time when you talk to someone, you talk to your doctor, it's just that a lot of women feels in this environment, there are some things that they don't want to discuss with the doctor they're used to. I noticed genuinely that there is a type of doctors women don't like changing, and that is their gynecologists, because they feel by the time they have opened their mind, secret and everything to a man, why should they see somebody else? But you need to see someone and talk about it. It's amazing what you will get away with if you talk to somebody who understands and he understands how to counsel the condition you're going through. Can I have the next one, please? And then, like I've said it earlier, the cause of all these symptoms I've been talking about is estrogen, the almighty estrogen. And let me just tell you a story of your life as a woman. When you were 16 weeks old in your mother's womb, you have your two ovaries formed on either side of your abdomen in the pelvis, where the uterus is, the fallopian tube and things like that. And from 16 weeks, you have about 125 eggs deposited in the two ovaries. Those eggs stay there in dormant form, they sleep. And they start waking up from the cascade of reaction from hormones from your brain, stimulating the ovaries to secrete estrogen, and the estrogen stimulating the uterus to make the lining of the uterus grow up. And then if for any reason you ovulate in the middle of the month and there is no sperm, there's no pregnancy, at the end of the 21st day, the hormones all calm down and you will have a withdrawal bleed on the 28th day and you start the cycle all over. By doing the calculation, I said about 125 eggs in all. And you release one every month from the time you get to menarche, which is roughly between 12 and 13, 14 weeks in most people, and you have regular egg release every month, and you stop your period at the end of your menstrual cycle, which is the menopause. If you do the calculation, most people will ever have released maybe about 420 of those eggs. So which means the rest just stay there, not doing anything. They can never be stimulated. And then when the ovaries gets to menopause, it goes to sleep forever. It becomes like a tiny white tissue in the pelvis. That is the life of a woman. Unlike what happened to men. The men have their testes at birth. May I remind you that life starts almost similar for a man and a woman in utero until about 7 weeks, when the hormones that makes the difference between the two starts. So that's when you start having, this is a boy, that is a girl, everybody start going their way, because the organs that make the male organs and the female organs start like a dot. And then the hormone changes change them at about 7 weeks. Men, luckily, will start making their own sperm at puberty. And then they will make their sperm till they die. And that's where life is a bit, I mean, we don't want to question God. That's what happened between a man and a woman. Okay? And of course, you have the cortisol overwhelming effects. which means the cortisol, like I said, there's timing for the cortisol release. That's the hormones that make you get up and go. And then if you have not slept and you wake up or you slept late, the cortical effect is just totally disrupted. And then you don't have your energy, and then everything will happen because life is such that unless for people who do the so-called duties, night duties, that's where their body adjusts. You see people who do constant nights duties, their body adjusts, their cortical effect changes. But for you that you are very normal, everything changes. And then of course, because of the changes, you are not prepared for the emotional, physical challenges. And then of course, you generate all sort of wasted burst energy when you don't need it. And at the end of the day, you are tired and you are afraid of the night. And then you see there's a surge in your immune activities as well. It just misplaces activities because it's not following the regular patterns that you should do normally in life. Can I have the next one, please? Okay, I mean, this picture, and that's what I was trying to say about the cortisol. The cortisol helps you with the fight or flight response, and it's timing. And that's why sometimes there's a limit to what most people will do. If they wake you up from sleep and ask you to do something, you still drag yourself because you only get about with your daily activities because with the timing of your body, when your timing of sleep is you go to bed about 10 p.m. and you wake up 5 o'clock to get everybody ready, your body had read it. Your cortisol surge starts coming in regularly because you have that biological timing around 4 o'clock. And then by the time you get up 5 o'clock, you are able to wake the children, get ready for school and things like that. Then you go around the day. But if you haven't slept well and your body, your biological timing is totally disrupted, then you just have misplaced. In fact, your children will notice that, Mommy, we're ready. Why are you sitting down? Are you tired and things like that? Because you are not yourself. You are not yourself because your fight or flight response is just totally misplaced. The timing is wrong. Can I have the next one, please? Let's just quickly go through because I know people by now have lots of questions for me. Of course, the test you can do health assessment because you want to know the diagnosis is right. But then most of the time, the diagnosis of menopause is by the history. And like I said, if you are at the age bracket, you have not done period for 12 months, then you don't need a lot of diagnosis because checking your level of hormones will just be academic. But then some people want to know. They want to look for particular hormones that are raised, okay? And of course, like I said, you worry about all sort of medical things. Of course, a lot of problems come in. You want to do your kidney, liver, thyroid function because sometimes your inability to sleep might not just be your estrogen lack. It could be due to your thyroid function too. Because if you have thyrotoxicosis, for example, that which means high level of thyroid hormone, you won't sleep. That's part of the problem, and you lose weight. Okay, and of course, you want to look at whether you are bleeding in the intestine. That's part of the test you do. Blood in stool, eye and dental checks, which is very important. Of course, seek professional help and invest in lifestyle change. Of course, maybe that's the time that you need to get a small treadmill in the house or static bicycle because sometimes some people feel, well, I don't want to use the word ashamed, but they don't want people to see them. So by the time you wear a training suit and then you want to go and jog on the street, they just feel everybody will be looking at them. But then you can do this in your house as long as you burn certain amounts of calories. Because when you exercise, a lot of blood vessels that are normally dormant, especially the ones in the heart and the lungs, open up. And it makes you feel good in yourself that you are burning the energy. So can I have the next one, please? I talked about stress relief, improve your sleep by changing your environment. You want to know whether your room is dark enough to create the night for you. You want quietness. If anything is disturbing you, any sort of discomfort, you try and take it off. You can work on it. You can work on it before you start taking medication, okay? And then, of course, your skin and personal care products. You need to be very careful. You want to be sure that these are products that have been duly tested, because if you go for new skin products that is not that is not approved, if you react to any skin product at this stage, it will take a long time before you get rid of it. So you want to be very careful. And of course, the type of food you eat. I've said that before. If you feel some food doesn't suit your system, don't take it. It's no need asking for trouble. Of course, the exercise and physical therapy, heal your gut, like I said. Decide on what you want. Because see, at the end of the day, food is about the content that goes into your system to help you to maintain your growth. And that is your fats, the amino acid, and the glucose. Anything you eat, you will digest in your system, but then you want to be sure that it's something that is easily digested by your system. Because I'm sure I'm going to be asked questions about food, about a lot of carbohydrate and things like that. But see, when we look around the world, in some parts of the world, because I know rice is always a culprit, but then when you talk about the Chinese, their main food is rice. I don't think they have a bigger problem with glucose metabolism than the rest of the world. Can I have the next one, please? Okay, then I talked about the effect of the lack of sleep before. Headache, irritability, lack concentration. Of course, if you haven't slept for nights, then you won't be the same during the day. Your cortisol surge is not the same thing. You just don't have the drive. And then, of course, you stay at home. The kids will come back from school. You still have to be supportive. And then you are just lethargic throughout the day. And then, of course, the slow response to reflexes and things like that, because you don't have the fight and flight response, okay? Of course, depression, because you have not been sleeping well, mood swings, and anger, you fly off the pan easily. Of course, the poor control of your blood pressure, and of course, your glucose as well, because I said with menopause, there is a bit of insulin resistance in some people. Of course, poor digestion of food. You just find out that most of the time, something that you can eat and go to bed, you try it after 8 p.m. some days, you have to wake up. You have severe indigestion. So you need to identify such food and you run away from it. Okay, can I have the next one? Yes, this is very major. And I feel I'll be able to have time to talk about it, okay? Eliminate disturbances, vaginal itch, okay? Age, stress, imbalance, resident bacteria.
Hello. Hello, sir. If you can hear us, we can't hear you anymore. Maybe your network. Hello, everyone. I'll get in touch with Dr. Oshinowo and see what's happening. Please just hold on. We can hear you now. What happened?
I don't know, the thing went off.
Technology.
Okay then, okay. I will, before it goes off again, because these are the interesting part about this. I was talking about what happened to the life of a female you don't have the flora that are supposed to be there. The flora are encouraged by the estrogen that starts coming in with puberty. And that's why you find out girls at the age of 9, 10, 11, even before they start their menstrual period, can have some minor type of discharge due to the colonies of the bacteria in the vagina. May I stress this? The vagina of a female is not a sterile place. Oh. And please don't try to make it sterile. There are some bacteria, I can count up to 25 bacteria that you will grow in the vagina when you do a swab that are supposed to be commensal. Commensal means they live there. And then you have in nature things like the bacteria and the yeast living in the vagina, and they checkmate each other all the time. And then what happened is occasionally, if you take antibiotics for a different reason, maybe you are treating sore throat or a boil on the skin, you could end up destroying the flora of the vagina. And then the yeast will take over. And that's why a lot of people will tell you that, oh, they took penicillin for sore throat, and about a week or so after, they started noticing that they have vaginal discharge. And I will tell the group this. A lot of us will remember the first time we made love in our life. You had about a day or two that you felt you have unexpected vaginal discharge, that you probably thought that you had infection from your partner. No, that's not what happened. You had your flora, your partner has his flora on the skin, and he introduced the flora to you. And you now spend the next 2 or 3 days trying to accommodate the flora, making it part of your flora. And of course, most things in life, either infection or healing, go through process of inflammation. And for that reason, most people, most women, if you blindfold them and you take like 10 underpants from different people and put it on their nose, most women will be able to tell you that this is my pants, because they are used to their bacterial flora. In fact, that's the principle of the dog trailing human being, because everybody have their flora. So that changes a bit during menopause. You now find out what you're having is different. And not to talk of, when I talk of the pant and fabrics, of course, if you wear cotton materials, they are very kind on the skin. Of course, the way you handle these cotton materials is different. Some people mistakenly will wash their cotton materials, leave it in a damp area without realizing that this cotton is a natural material. What happens is with the dampness, fungus will grow in no time, and you don't notice, and you put on these pants mistakenly, then the fungus can now go on your skin. You start having what looks like skin reaction, and you take it, you think it's a bacteria and things like that, you go around the clock. And of course, a major mistake people make is that because they want to clean their vagina, they want it totally bacteria free, they put a lot of detergents in the under pants. And of course, most of the time when you use this detergent, because the soda don't completely dissolve, you have some soda bubbles like the white speck that you see in the bowl after. Those are soda, they stay on the pants. When you now wear these pants and you sweat, you dissolve the soda. And that soda causes chemical reaction to your skin. And people will always think that they have infection. And they will even do more, they pour more detergent, pour Savlon, pour everything. You will just get yourself in a cycle. The best soap to wash your underpants is a key soap or bar soap. It might look like it's not clean because the dirt you see there is not really dirt. How can dirt get to that part of your body? It's your skin you are looking at, because your skin come up from time to time. So you just want to keep it clean. Use a soap that you can dissolve. Detergent is not really advisable, okay? When you take antibiotics, I have said that, you have to be careful. Some people are prone to having yeast infection after antibiotics. Tell your doctor, you can always prevent that. Don't overclean. And of course, for some people who have high blood glucose, especially if they are a confirmed diabetic, they tend to have a lot of itching around the place. Of course, foreign bodies. If by then you still have an IUCD fitted, because of the thread coming out, then you are likely to have all sorts of changes in your vaginal discharge, and then you have itching. So because there's no need for it, then take it out. Of course, I've said a lot of things. I have not talked about douching. Douching is not advisable, especially if it involves any chemicals. It disrupts your flora and gets you into trouble. Your vagina is not different from your mouth. You pour water in your mouth and you rinse. Then you can use clean water with your finger to just rinse your vagina. It just brings down the discharge. You are not changing the flora. Can I have the next one, please? Okay, then you know your personal eau de perfume, because you see, if you don't test it, you get into trouble. But then, I mean, the aim is not to dab it too much and start irritating you. Of course, your discharge, okay? And of course, when you pee, dab. If possible, use water, if you get water, but don't rub, because the skin is so thin that if you rub, you might peel your skin. This next one, pee after sex. I'm not sure everybody is aware of that. I will say this. The bladder of a woman is on top of the vagina. And what separates the vagina and the bladder is just a thin skin. And of course, like I said before, the vagina is not a sterile place. There are bacteria there. And of course, part of the secretion that you feel, secretion, you have the lubricant, has some bacteria in it. And the opening of the bladder is just on top there. And anatomically, during making love, the man pushes some of the bacteria back into the bladder. And then if you don't get up to waft away this bacteria, bacteria have their way of growing. You'll find out that within 6 hours of sleeping, the bacteria that are normally commensals in the vagina, they are not necessarily friendly to the bladder. And then, of course, the bladder is irritable. The estrogen effect is not there. The tensile strength is not there. It's not stretchable again. It peels, it's bruised easily. And then with the bacteria coming in from the vagina, you end up with recurrent urinary tract infection. The best thing you should do after making love is to make sure whatever is left in the bladder, you release, and it can help you to push the bacteria out. It is very important. I'm not talking of washing after. I'm talking of emptying your bladder. And of course, I don't want to take any, say this to people, because I believe by now everybody learned that you wipe from front to back. I'm sure everybody knows that. I don't want to ask stupid questions, okay? Wash with water and then pat dry. Of course, trim unnecessary hair, but then you need to be careful. I said trim, I didn't say shave. If you shave, you need to be careful, because when you shave and the hair is growing, because the oil is reduced, then the hair grows at an angle. The edge of the hair will go to the other side, and pricking the skin causes reaction, and the reaction causes histamine release. And that's what a lot of men have at the back of their neck that they think is infection, or men who shave have by way of bumps, because what happens is basically bumps. It's not infection. And then when you itch, you scratch it, it gets bigger and bigger because there is bacteria there. You might now get infected. So you need to be careful what you use there. Okay, next one. Okay, well, I mean, these probiotics, people do that because I'm sure for those of us who have children, I mean, they suggest this, vitamin C tablets, okay? Because like I said, bacteria is normal in the vagina. If for any reason you clear it, you get into trouble because the yeast that is not affected by the antibiotics will just grow. And if you take too much anti-yeast, the bacteria will grow. So the two of them have to live together. Okay, avoid antibiotics misuse, wash new underwear, cotton, before you wear it, try and wash them because sometimes when they are new, you never know what chemical they use because things are made all over the world now. In fact, some people have even got to the state that new dress generally, they wash before they wear because people have been known to have reaction, okay? And then of course, well, with panty liners, you need to be very careful because some of them might cause reaction because bruising your skin, okay? Hydrate, eat healthy food, and do exercise, like I said. Can I have the next one, please?
That's the last slide, sir.
Okay then, that's fine. I have tried to talk. And of course, people were waiting for the punchline, and the punchline is menopause is when you stop your period and you have not had a period for 12 months. The age range is 50 plus or minus 2 days, and there are symptoms or problems that are related, which I have tried to talk about. I sincerely hope I have helped with what I presented. I will welcome questions now. Thank you.
Thank you very much, sir. Thank you. You have done a wonderful job today for us, and I'm sure everyone listening can attest to that. You have touched on every area, and I dare say that most of the questions that we got during the registration, you have touched on those areas. We have some questions in the group, and we will take them quickly for reasons of time. Somebody talked about the causes of tingling feeling in the left part of the breast, arm, and to the legs. Can it be the same estrogen, sir?
Yeah, it's the same estrogen. It's the same estrogen, and is the effect of the estrogen on the calcium lack. I deliberately did not talk about HRT because I expect that to come in question.
Yes.
Yeah, I expect that to come in question because, you see, if I talk about it, I mean, people might not remember what I said. But if there's a question about it, the tingling sensation is due to calcium lack, and the same thing, you have muscle twitching, muscle pain, and of course, bone pain. That is when it's getting to the severe end. And I'm sure some of us, we know Queen of England, Queen Elizabeth. And if you really want to judge her, you will feel she's lost up to a foot of her height. These are the things you get when you have osteoporosis from estrogen lack due to menopause. That is a typical example. And like I said, once the calcium is out of your bone, then you will not be able to replace it. And what you can do about calcium not leaving your system, even not minding the bone, is at this age, there are tests you can do. When I say you do blood tests, they need to check your vitamin D level because vitamin D is very important in your calcium absorption and metabolism. That at least will help you because you don't just need calcium in the bone. You need it for the movement of your heart, the movement of the muscle, and the movement of even the blood vessels. Anything, anywhere you have muscle and it moves, you need calcium.
Okay, let me understand this, sir. When you said that calcium cannot be replaced.
In the bones.
Well, in the bones. So taking supplements with high milligrams of calcium and vitamin D doesn't help?
Once you have allowed your bones to be lose their calcium deposits. So with that one, prevention is better than cure.
Wow. So this is why we should talk about things like this from an early age.
Yes,
so most
from an
women
early
in their
stage,
30s,
you want to understand, yes. And
their
that's why
30s could
around the
know
world,
about it.
okay, sorry, around the world now, the test they ask you to do at an early age in their mid-40s is your vitamin D level. And then if they're going to give you supplement at all, they put calcium. Of course, in some parts of the world, they have fresh milk, which is a good source of calcium. So it's better prevented.
I still want to know. So the calcium that women are taking right now, because I take calcium, are you saying that it's not absorbed by the bones at all? I mean, by the body, and it
can
can't
be.
affect any
Oh,
changes in the bones?
okay, well, let me explain this better. The bone is such a hard structure that has some framework. It's like having a concrete whereby you have metal rods and things like that, and then they do the mortar and they put it inside. If, for example, the substance of the concrete, the metal rod is being removed, you can't put it back. I hope you get the message where I'm saying it's better you prevent the metal rods from being corroded.
Okay, so what can women do? Because a lot of women, from the various questions, they have body ache, joint pains, the bones are aching, the bones are creaking. So at this time, since there was no prevention, which is better than cure, what can they do now?
Okay, like I said earlier, your joint pain, your body ache, and things like that is not necessarily due to bone pain. It's due to the other aspects that depend on calcium.
Okay.
Your muscle movement depends on calcium as well. But it's just that once you start feeling the clicking sound from the joints and things like that, with that one, there's not much you can do. Because the replacement of that is almost impossible. In medicine, you are taught not to say things are impossible. But like I said, prevention is better. You see, if this topic is well discussed, then people will realize that, oh, at a certain age, this is what they need to do, and this is what they need to be taking so that they can prevent. But I will say this, for the joy of us being blacks, overall, I think the blacks generally are known to have heavy bones. So we suffer less. There's a racial protection. We suffer less from osteoporosis like the Europeans. And of course, see, they tend to, I mean, when you look at obesity or even heaviness, I mean, it's commoner in blacks because we tend to have strong bones. That could be a racial protection. So if you take the medication,
good news. Thank you for that. Yeah. And now we have a question on what are the benefits and risks of HRT?
Okay.
I want to know especially because of my symptoms. I've had all kinds of symptoms. So I really want to know, and people have been asking that. And I also hear that a lot of Black women don't go for HRT. And we want to know why. Is there any risk? Is there anything that, within the African context that can affect us? We want to know.
Okay. I think the problem we have as Blacks, or let me talk about Nigerians, is we discuss a lot before we find out the facts about anything. People, we always know somebody who took it, who had this problem. But then if you try to find out who exactly was the person that took this medication or had this problem, and then somebody else knew, and then somebody else knew, you don't know. And I will start from this. I will ask us to go and buy Panadol and read about the leaflet of Panadol, what side effects Panadol can give you. Then you will not take Panadol again.
There are lots on it.
Yeah. So the same way medication that they have to write possible side effects. And for an individual, it depends on what you feel. There's one condition that happens to every human being, and that is pain. Nobody can measure pain. But when people have pain, all you need to say is, do you want something for this pain? And the person will scream, yes. Do you want an injection or you have tablets? And the person will say, no, I want this pain away. Give me injection. That is what pain is all about. The menopausal symptoms is an individual thing. You know how it's affecting your life. And then they told you that you need to take this hormone, the HRT. I must explain, this hormone is not the same hormone you take for contraception. This hormone is half metabolized. It's supposed to be milder. It's supposed to be something that your body had done. If you get the natural hormone, your body is all half metabolized. It's supposed to help with some of those symptoms that you have. You will find out everything we talk about is about control in the brain. Your sleeping center is in the brain. Your blood pressure center is in the brain. And if all those centers lack this hormone, everything will go awry. And you find out that the treatment of choice for menopause is the HRT, the estrogen replacement. But this is half metabolized. The common one, if I tell you, there's one that is very common. They call it Premarin. Premarin is Premarin, Premarin. And what it means is extracted from the urine of, originally, the urine of pregnant mice, which means is the placenta from the pregnant mice that is now pure, which means is metabolized. It doesn't have the side effects of the normal estrogen that you take for contraception. And of course, then we have to talk about the risk of cancer, the risk of this and that when you read all that. But I will tell you, millions of people all over the world take it. The Europeans take it a lot. And that's why you will have somebody like Nancy Reagan then at her age jumping around because she's been on it for a long time. And if you want to talk about the side effects before, and of course, when you're taking such medication, it's not something you just go and be taken off the shelf. You are being examined. Because of the side effect of the estrogen on the breast, when you take it, you will take another hormone, the progesterone, that is supposed to reverse the effects of the estrogen on the breast. And then you, of course, it's not as if you have menopausal problem, you still don't have some of these unfortunate conditions. So, but the person taking it, we know what you have gained from it. All I know is that the people who I'm able to convince to take it don't ever want to stop it.
Well, so I wanted to ask you that you have a large percentage of people facing HIV.
Yes. And in fact, the practice I even do is when you need to have hysterectomy at a certain age, around 48, 50, I will counsel you to let us remove everything so that the risk of you needing anybody to go inside your tummy is reduced. And what you are likely to lack immediately is the estrogen. Then you can have an implant for as long as you want.
Okay, thank you very much, sir. I have been enlightened a lot by that. I have a question. What do we do about the insomnia? A lot of women have insomnia. What can be done about that?
Well, the HRT will help you first, okay?
Okay.
And then, of course, there are some medication. There's one that is not very common that you can use. It's not hormonal, but because it works centrally, it could affect the sleeping center and people will sleep. It's called clonidine hydrochloride. It's normally used for hypertension, but you find out that most people that have this problem have problem with their BP anyway. So when they take it, the dose can be very small. The dose can be adjusted. For some people who are really afraid of the hormones, can try that.
Okay. So that
Yes.
helps with the food.
Yeah, yes,
Okay.
that can help. That can help. And of course, your sleeping pattern will change. You see, because what happens is if you can't sleep at night, you're tired during the day, and then you try and now catch up with your sleep during the day, then you get yourself in the cycle. Try not to sleep during the day. Because if you are tired in the real sense, you will doze off.
Okay.
Like I
So
said,
mhm.
like I said, you are afraid of the night.
I was terrified of the night many months ago. Terrified.
Okay, yeah, so because, okay.
Thank you very much. Another question here, because we've talked about calcium and the joints and all of that, but the general pain, the pain all over, if someone doesn't want HRT, what supplements do they take to help with that?
Well, I mean, really, you can take as many supplements as you want, because you see, when it works, you think it's what is working. When you have pain, you take care of the pain.
But is it good at this time to take Panadol or Cataflam, those kind of
Well, Panadol is different.
medication at this time?
Yeah, the Cataflam is a non-steroid anti-inflammatory. If you take it in an empty stomach, mind you, your stomach lining is not as active as what it is. If you take it, then it might start giving you ulcer-like reaction. So sometimes it's better you just take Panadol, because when you take Panadol for an acute pain, it will work and then it will last about 6 hours. Well, you find out that you have certain things that cause this pain, then you need to prevent it. But if you exercise regularly, you might be able to, with the endorphins, you might be able to get rid of the pain. Try and exercise. You don't need to strain yourself. You don't need to strain yourself.
Another thing is the hip or the hips. Some people, a lot of women, they right hip. I hear a lot of people say, oh, the right hip just aches and it's painful all the way to the buttocks down. What's the remedy for that apart from HRT?
No, I mean, it's the same thing. It's the same thing. You take painkillers and then you exercise it, because the hip is about using it and exercising it. It's the same. And then, of course, mind you, when I say HRT is an end of it to help with the lining and things like that. The calcium you take is still helping in the movement of your muscle.
Yeah.
You will always need that.
What about the omega-3?
Well, omega-3 is one of those things that is described. If it suits you, it suits you. And I will say this openly now. I don't mean to get in trouble with the drug companies, the pharmaceutical companies. The drug that sells most in the world are the vitamins, the multivites. And then, of course, if they tell you there is no evidence that it works unless it's been proven that you lack it. Okay. You understand what I've just said?
Yes.
Good business, but you take it. If you don't need it, it will help with the roughage in your system. It gives you roughage in your physics. So omega-3, everything, everybody talked about what they want. I've just told you about the vitamin D level and the calcium. And then you can get that from also fresh milk, calcium supplement, CAC 1000, because you need calcium in all the muscles of your body. Even sometimes you can feel your eyelids twitching. It can be due to,
and then dry eyes as well.
Dry eyes. That is due to estrogen lack. Because there are some of the things that you can apply, because there are, for dry eyes, there are some eye drops that have estrogen in it.
Okay.
That's for local. Even for dry vagina, you can have some estrogen creams.
Yes, I was going to ask about that, because I know that there's this estrogen called Vagifem.
That's local.
The local. Yeah, so if one takes that, it helps only with vagina dryness.
Oh yes, because it's absorbed locally.
So it doesn't help with other symptoms.
No, no,
other
no.
menopause symptoms?
If you want to do anything about the other symptoms, you either have to take it in such a way that it's absorbed into your blood system in a lot. Although part of the one you apply in the vagina might go into the blood, but that is never enough.
Never enough. And the HRT comes in what? In patches?
It comes in patches, it comes in tablets, it comes in injection, it comes in implants, in different things, because you see, that depends on how long you use it. If you use patches, most of the patches, you leave for a week or so, and then you take it off because it's absorbed slowly through the skin.
Oh, I thought you could use a patch for a year. So it's weekly.
No, I mean, if a patch that you put on your skin for a year, your skin will react.
Mm-hmm. Okay.
Unless they are doing a slow release that can last a year, because that you probably end up, I mean, are you going to be avoiding that part of your body when you're having your bath or what?
Yeah. Okay. And then how long can one be on HRT?
Indefinitely, to be sincere with you.
How
Indefinitely.
old can a 60-year-old, 65, 70 take HRT?
Well, some people can still take it depending on what they feel is using, because I find out that when people take it, they want to really hold on to it. And of course, the idea is you want to prevent certain things. I mean, let's forget about the bone effect, about the irritability, sleeplessness, dryness, and things like that. And if you stop and you don't feel that, because for some people who refuse, who want to put up with all the symptoms, they get better or they get used to it. Let me put it that way. They get used to it. So it doesn't matter when you stop, you might feel the same way. Because
Okay.
what you worry about normally is what people feel, the side effects, your breast, you can cause it, and then you get yourself checked regularly.
Okay. Someone just asked, can a 57-year-old use HRT? Yes, Dr. Oshinowo just
Yes,
answered.
yes.
Any age, really can use HRT. Have you heard of, not have you heard, of course you're the medical professional. The black cohosh is common. They say it helps, black cohosh, and there's another one called red clover. They are all herbal remedies for menopause. What do you have to say about that?
Well, you see, you are dragging me into the field that we can argue, you see, because until these things are proven, and okay, I've told you basically why these problems are there. And it's all basically the sleeplessness, the irritability is in the brain. It's about particular center having what it needs. So if the black hole or all those things have what feels like estrogen extracts.
Yes. I understand some of them mimic estrogen. Yeah, like isoflavors and all.
So if they test that, but then they need to be proven. You see, because the principle of the treatment is the same thing, whatever you take.
Yes.
If it can be proven that, because see, most of these drugs, a lot of drugs were extracted naturally, but now they are being manufactured and they still do the same thing. I mean, you use the word mimic, yes, they do it. Because sometimes body is ready to be deceived. There are all sort of medication that you apply.
Okay. A question here. We'll take the questions very quickly now. It says, is there any concern with getting perimenopause at 43? You said
no, well, that's premature, but it can happen.
Yes, because I stopped my period 42.
Yeah.
By 43, I was in menopause already by 43.
Yeah, it can happen. It can happen. I mean, you see, with such people, I would just encourage them to be taking the calcium for all it's worth, because you see, like I said, you want to prevent your bone being eroded. So take supplements.
Okay. Somebody is going crazy about their breasts having the tingling sensation up to their leg. What do they?
It's the same thing. Is a lack of, yes, is a lack of. I mean, if the person wants to try, you can get the estrogen cream, because and then apply it and see what happens.
Oh, there's an estrogen.
Yeah, the cream, like the same cream that is applied in the vagina. You can just rub it on.
Oh, okay. Okay, yeah. That's interesting. That's good to know.
Mm.
And then one says here, having discharges of blood and other bodily fluids at different intervals. are there specific ways to confirm these symptoms, and how can they be managed?
Okay. When you have bloody discharges, is it after intercourse? I'm not asking the person. I just want to say, maybe the person can figure it out. Is it after intercourse? If it's after intercourse, when you look at vagina of a postmenopausal woman, it looks as if it had tiny, tiny specks of blood because of the lack of estrogen. We call it atrophic vaginitis. And such vagina having the rubbing effect of intercourse can come out with what looks like bloody discharge. But generally, if that person is having what looks like blood after the definition or confirmation of menopause, the person needs to be examined, because you don't want to assume it's from the vagina. It might be coming from high up.
Does menopause symptoms or postmenopause, does it ever end?
Well, the way I can put it is people stop talking about it. Either they're tired of it, or what they were feeling got better by way, or they adapted. So that's why it's very difficult, because you see, it's like, you know, in the slide, I said something about some people after the menopause, after starting the period, they might have as many as 30 years to live. Yeah. I mean, you can't really be talking about menopausal symptoms with a 80-year-old. I mean, you say, what? I beg your pardon, what are you talking about? They don't even have time for that at that age. They don't have time for that.
Well, the reason why women are they're asking, because some symptoms are really, really bad, and they're wondering, okay, when would I have my life back? You're suddenly feeling like a strange person, like another person, and you're wondering, when will this be over? Is there a time? Is there a time I can wait or something? That's why.
Okay, that's why I talked about, if you notice, I started my slides with what you will take away today from the talk. That's why I started from that. Because with all that application and this question, then you know how to apply it. Because you see, it's going to involve a lot of change of lifestyle. Because menopause is not like a light switch that you put on and off. You cannot tell. I mean, and what happened to A is not necessarily to be the detail of what happens to B. People just have different ways of, yes.
True. By the way, for all those that are listening, this session is being recorded, and we will send to your emails after. Somebody just put up one, painful sensation in the armpit. Not that they are boils, but they're just painful.
Okay, whether it's rubbed, and the person must have rubbed it, or something had happened, or you need to be careful about what you're rubbing by way of antiperspirant and things like that, because they can cause chemical reaction, because you are very sensitive at that age. Because so you need to be, but sometimes people shave without realizing it, and then they apply what looks like aftershave and things like that, and then it goes through the process of healing. If you remember, inflammation can be due to infection, can be due to healing, and can be due to reaction to foreign things. So, and then that pain is not there all the time, it will go.
How often should exercise be done in order to avoid energy drain?
You have to do it regularly.
Or just 3 times a week?
Yeah, well, no, I mean, I think that depends on the individual, honestly, because sometimes...
is it 15 minutes okay? Because I understand, 15-minute exercise.
Yeah, well, I mean, as long as you burn some calories, that's fine. Because like I told you, when you exercise, your pulse rate goes up, you move your blood, and your blood gets to parts of your body that normally don't get. I mean, it's like you have a drainage that is blocked in some place. What happens is that the water will be tracking on one side, but if you clear the drainage, the water flows.
Yes.
That's what you achieve with it. And then even the calcium you take is carried in the blood to distal parts of your body. So even you find out that maybe
Okay, we've lost connection there. He will be back. Please just wait. I hope we're answering your questions. We're trying to answer as many questions as possible, get him to answer as many questions as possible. Some of them he did answer in his presentation. So if you were not here when he started, we're going to send the recorded session to you. We're waiting for him to come back. He'll be back in a few seconds. Is it back? Okay. When Dr. Oshinowo comes back, we will look at the question. Somebody said or made a comment. Somebody just sent something here that they sent a question before the end of Dr. Oshinowo's presentation that hasn't been answered. Could you kindly post the question again? We're trying to group questions together, similar questions. We just ask one question. Please post your question again, whoever made that comment. Dr. Oshinowo, start, please. Okay, should be the one coming in now. Okay. Hello, sir. Hello, sir. Could you please unmute your microphone?
Okay, yes, I was trying. Okay, I can hear you now.
Okay, thank you. Welcome back.
Okay.
Technology is good to us today. Now the brain fog, I can't even remember where we were before you left.
Yes.
But if we're talking about exercise, and I think
Yes,
you had covered that, so
okay.
that's good. Could there be a relation with the use of hormonal family planning and suffering from thyroidism?
They're not really, they're not much. But then, like I've told you, in medicine, you never say things are impossible, because the contraception pills is just estrogen and progesterone. And like I told you, of a normal cycle of a woman, you have the hormones from the brain stimulating the ovaries, and the ovaries release estrogen that starts at the beginning of the cycle. And then when it gets to mid-cycle, when you ovulate, the progesterone starts producing. And if there is no pregnancy, at the end of 21st day of the cycle, all the hormones come down and you have what we call withdrawal bleed. The normal contraceptive, what it does in effect, when you take it, because the estrogen, while you're taking the medication, I'm going into technical details now. While you're taking the medication, what it does is, because it's estrogen, and like I said, we both said that medication can deceive the body. The body will read the estrogen level in the blood as the one being produced by the ovaries. And the effect of the production of the ovary is for the estrogen to damp back the stimulation from the brain. So the ovaries will go to sleep while you're taking the pills. The ovaries don't produce anything. So what you do is you take the pill regularly for 21 days, and then you stop. The last 8 days of the normal pill is ordinary tablets. When people look at it, it's red, it's iron tablet. And the effect of that is just to prevent you from taking the medication. Most people will find out that when they have taken the 21 days of the pill and they're on the last 8 days of the red tablets, they will have their period. And then by the time they finish the tablet, they will start a new pack of the pill. And that's what that does. So that has absolutely nothing to do with your thyroid. But what happens is if you have problems with your thyroid, if your thyroid gland is firing and things like that, it can affect. And it's similar because in chain and property is similar to the hormones from the pituitary. And then it can affect the chain of that. And that's why if you are not taking anything to control your period and you're having a natural cycle and you have problem with your thyroid, it can affect your menstrual flow. And that's why when people have menstrual flow, one of the tests you want to do is to check for thyroid problems.
For thyroid. Okay.
Yes.
Thank you.
And like I've always said, you need a proper diagnosis.
Yes, proper diagnosis is very necessary. You said at the beginning of your presentation. Now, apart from Vagifem, that's local estrogen and lubricants, is there any other thing somebody's asking to help with this problem with sex intercourse?
Oh, no, I've just said you use water-based lubricant. Yes.
Okay. Is constant or prolonged sore throat one of the symptoms of perimenopause?
Well, it could be the dryness because there's dryness of mouth.
What's the best thing to do for that?
Sore throat is not necessarily due to bacterial infection. It could be viral, it could be trauma. It could be trauma because you see, if for example, you swallow a bone that scratches your throat, you will have sore throat. Like I said, inflammation could be healing, it could be infection, it could be just trauma.
And what's the best thing to take for that? Vitamin C?
Most of the time, you want healing to happen because it could be swelling. And that's the advantage of gargling with salt water. Because I want to believe we all know what salt does. Because see, the salt desiccates bacteria and it reduces swelling of the skin.
Okay. Heavy menstrual flow and cycle not consistent on monthly basis, and I'm turning 44 soon. What does that mean?
Well, the person needs to be examined first before you're given the green light. The person might have fibroids.
During perimenopause, some women have very heavy flow?
Yes, they can do.
Some have little flow.
Well, if you come to me and complain about little flow, I will say, congratulations, go away. If you come to me and say it's heavy, then I will say, oh, let us find out you don't have something sinister happening. So you might need to have what we call a diagnostic DNC, whereby a sample is taken from the lining of the womb to find out that you are not having problems. Because you see, we cannot blame everything on menopause. You can have some potential problem happening and not assume it's due to.
Should visit their doctors. Okay. Somebody asked, where can I buy HRT? And I think my other co-host has put your hospital address, because someone else asked for the hospital address. Dr. Oshinowo can be found at Premier Specialist Hospital. What's the address again? Ogalade Close.
7 Ogalade Close. I wasn't going to say it, so that it doesn't look like advice.
I know the place.
Okay.
7 Ogalade Close, Victoria Island. That's where you can find him, and I highly recommend him. What explanation? Oh, they want to know cost of HRT.
Oh no, I mean it's not very expensive. I mean I don't know it offhand. It's not very expensive, and it comes in different form. I mean I've told you the principle. It's all about how metabolize estrogen, and then they combine it with some progesterone so that there is breast protection and protection of the effect of the estrogen. So you don't just take estrogen.
If we look at it on the average in a year, how much would one spend on HRT?
Okay, to be sincere with you, if I say average of about 2,500 a month, so we can figure that out. A month.
Naira.
Yeah, in Naira, yeah.
a month
Yeah.
average. That's reason to know.
Yeah, so. But I am not quite sure, but I don't think it will be more than that, because you see, it's all about coming to terms with it, and you are decided you want it to happen.
Mm.
Please, can we just say this? It's not like Panadol that you take for headache and the headache goes. It might take some time before you see the effect, because that's why people don't take it for long, because they expect the effect within few days. And if they don't get the effect, they lose confidence in it.
When would one really get it? What's the minimum time you would give?
Around 3 to 4 weeks.
3 to 4 weeks.
Yes.
Okay, that's good. That's good. Okay, there's a question here. What explanation can you give for painful vagina and itches during menstruation, even having used different sanitary pads?
Well, you see, when you say vagina itching, are you talking of the outside or the inside?
Mm, there is a
Because if
difference.
it's outside, then some of these sanitary pads, actually, you don't know the production, they rub the skin. And I will tell you this, to really do these experiments, rub the same part of your hand against each other for some time. Rub it for maybe about 10 minutes and leave it. Then you will have what feels like peppery pain. And that's what you have. When you have a pad on and you move, there's rubbing effects. And that rubbing effect can trigger a inflammatory reaction. And then there will be some swelling, and then there will be some pain, because that part of the body, especially the space between the vagina and the anus, which is called the perineum, is highly innervated, and it reacts to pain easily.
Okay.
So, and that's why it's advisable for most people, if it's convenient, when you're having your period, use something that you put inside, like the tampon, instead of the pad that can be rubbing.
Thank you for that. And what about the place of being hydrated? You know, to keep hydrated, water, because we didn't talk about that, drinking a lot of water.
Oh, yes, I mean, you can always do that. You see, the good about hydration is, the good thing about hydration is if you're drinking it, you can't take too much, because your stomach, your intestine will determine what gets into your system. Okay. And of course, when you hydrate well, you pee well. So there's less time for bacteria that wanders into your bladder to get you into trouble.
Okay. And then we also didn't talk about incontinence, urge incontinence. Then some people even actually have, some people actually wear the bed at night.
Yes, you see, the bladder is one of the organs that is terribly affected by the lack of estrogen. If you see the picture or the ultrasound scan of a normal bladder in a young aged person, it's very thin. And then in menopause, it seems to have shrunk a bit, and the lining being incontinuous, as if it's have what looks like rogue, and it's not, the tensile strength is really disturbed. So each time you have, maybe normally you can have about 350 mils without getting into trouble. With time, because of the lack of estrogen, 150 to 200 will be a problem. And then when you are not careful and it fills up, there is a condition we call overflow incontinence. When the bladder is too full, it will just, the valve will open itself up without you knowing. Yes. And then you wet yourself.
Some women barely make it to the bathroom.
Yes. And then you see, the way out of that is to know your system, go immediately you feel like. Because if you don't,
because some people do that. Once they see the bathroom, like, I better use the bathroom now.
Yeah, because you see, it's due to lack of estrogen. And in fact, for such people, they can take the HRT even short period just to improve on that and continue. If they are afraid of the long-term side effect of the HRT, they can take it for a short period, because I do recommend that for some people sometimes.
What about the pelvic floor? Because some people, I've read some places that the pelvic floor, the weakness of the pelvic floor can actually be the reason for the urge incontinence, or one of the
Yes,
reasons, rather.
well, you see, if you put it this way, the incontinence is not very common in people who have not tested that pelvis. For example, let me qualify what I mean. If you have not had babies, big babies through that pelvis, if you have had cesarean section to deliver all your babies, such people have less problem with the pelvic muscles because it's not been overstretched. Because
Oh, okay.
when you talk, you see, people who had many children vaginally, especially big babies, have more urinary problems during menopause with people who have not gone through that. And that's why sometimes for some of them, the condition is so bad, stress, incontinence, and things like that, that they actually need to have the surgery to tighten up that part of their body. They
surgery.
need, so they need surgery. They need vaginal repair to do it. Because, see, the problem with the bladder could be due to what they call, yes.
I'm just hearing about vaginal repair.
Yes.
So it helps with incontinence. For what else? What the other have with vaginal repair?
Because there's something you didn't mention. For a lot of them, apart from the water the bladder just opening up, they cannot sneeze or laugh. It becomes a problem, because for such people, they might need some help to tighten up. Because if you examine them, you might see something coming out of the vagina, which can be anterior or posterior. If it's anterior, it's coming from the bladder. If it's posterior, it's coming from the rectum. Or if it's the whole uterus itself, then we call it uterovaginal prolapse. It could be due to that. They need to be examined. One should not assume that it's just due to menopause.
Okay. Somebody asked what's the full meaning of HRT. If you're listening, is hormone replacement.
Hormone replacement therapy.
Yeah. And how does estrogen reduction affect hormonal family planning with respect to menstrual symptoms? I think we already answered this.
Oh, I mean, because you see, you can't really compare them because they are totally different things. Because you take the hormonal family planning at a certain age. In fact, to be sincere with you, it's generally not advised that you take the combined pill from 40-year-old. It's not advisable because the side effect tends to be more potentiated. You take it at a certain age. After 40, you don't take it. You use something else.
Okay, somebody just asked what kind of women need HRT, and I'd like to say to the person that if you cannot cope with your symptoms anymore,
yes.
Go for HRT.
For help, yes. Like I said, okay.
Go on, sir.
No, say it.
I was just going to move to the next question.
Okay. Let me see.
Bringing this to a close soon. Managing symptoms. Somebody here is asking, how do we educate family and friends about symptoms so there is no conflict?
Okay. I want to believe that this discussion has helped a lot of people to realize that there's no secret about it. You are not alone. It happens to everybody. And then the more you talk about it, the more you learn. And you can read about it. And I'm sure, I want to believe at least 90% of the people on this Zoom today read about it. And I want to believe, and I hope, some of the things I said did explain what they read and they didn't understand. It's a natural thing. It's a natural phenomenon. It happens to a lot of people.
Okay, and then are there foods we can eat?
Yeah?
Natural remedies, foods we can eat. Do you have any recommendation?
The food you can eat is about your convenience. As you see, I talked about food because you see, sometimes people will say rice is not good, yam is not good, what is it not good? That's always a problem. Food is about digestion. And when you digest your food, the only thing you take are the end product that your system use. The amino acid from the protein, the glucose from the carbohydrate, and then the fat from the fat. That's all.
What about sugar now? That's another question.
Of course,
is it good at this age with menopause symptoms? What's the effect of sugar?
I know you need to be careful because, like I said, you might
Sugar,
have.
caffeine, and alcohol.
Well, when we talk about alcohol, I mean, that's the level of everything. In fact, with the alcohol, you find out that if you can really go on the bottles when you are young, when you get to menopause, you will end up with hangover, indigestion, dyspepsia, and discomfort. Then you stop it. You stop it. There's a limit, though. I mean, really, this is the age of everything in moderation.
Everything in moderation. I like that. So if somebody is listening, everything in moderation. What would you recommend? I wanted to keep this last. It says, what would you recommend for someone who is trusting God for children and have shown the various symptoms at different times and haven't seen the period in about 4 months now, and she's 46? You talked about IBM.
Yes. No, if the person has not seen period, I mean, I want to believe the person had done some tests to find out she's not pregnant.
Yes.
Yeah, so, and then, it could be what we call perimenopausal. It might come after 3-4 months because, you see, 46 is not the age. But then, having said that, I have seen somebody that got pregnant spontaneously at 48. And I looked after the person.
Can you get pregnant during perimenopause?
Yeah, you can.
Okay.
You can because, you see, like I told you, the eggs were there in the ovaries in dormant form. You never know. You see, there's something about nature that you cannot tell. Anything could happen.
How long is perimenopause? How long can a woman be in perimenopause?
It varies. It depends. It really varies. Because you will be peri until you go into it. I mean, really, you can be peri for about 3 years and then you go into menopause, like I said, is when you have not had a period for 12 months.
Okay. So the symptom that is very common again is brain fog and memory.
Yeah.
HRT, I assume, will help with that.
Yeah?
The HRT will help with that.
It will help. It will help. It will help.
So where one is not taking HRT, what memory medication do you recommend?
No, you need to work at it. Because once you realize that's what your problem is, then you need to, I mean, that's lifestyle changes. Because to start with, if it happens to you, you start wondering whether you're going around the bend. But once you know this is likely to be the problem, then you can adjust yourself because you have to go through it.
But how do you boost the memory again? What are the things you can do? Exercise, you said.
People talk about all sort of hormones, even stimulation of your memory, doing some games, doing everything. So that there's no end to that, to what people talk about. But whether it works or not, it depends on the individual.
But the HRT helps.
And because the HRT, I said something about taking Panadol for headache without treating the cause of the headache. With the HRT, you know what is happening. And you know it's because there's lack of estrogen. And then you want to deceive the body by taking some estrogen to do the work your ovaries were doing.
Okay.
And that is the whole aim of doing it.
And finally, anxiety.
Well, then you need to calm down. It's a case of mommy, calm down.
Mommy, calm down. Some people have trouble anxiety going through the roof, where they can't even do anything. It has happened to me where I can't even do anything.
What I would say about that is if it happens to you and it happens frequently, and you don't know why you're doing it, sometimes at the end of every storm, there's calm. When you have the calm after hitting the roof, don't you think that, oh, this is not me, what's going on? And I think with this sort of talk, and you know that, oh, it's because of your hormones going haywire, then it's a bit reassuring. At least you are sure you are not mad. Because that's the first.
That is what a lot of women say. You know, on Instagram, a lot of them say that oh, now I'm glad to know that I'm not crazy. I'm glad to know that I'm not mad.
I just decided to use the word mad.
Thank you very much, sir. It's been quite an enlightening session with you, and I'm sure everyone who has listened in this conversation, you have been enlightened, educated, empowered, and you know what to do now. You know the decision to make. We all know where to find Dr. Oshinowo. If you need to have a chat with him, he's a Premier Specialist Medical Center, number 9. The membership, number 7, Ogalade Close, Victoria Island, Lagos, Nigeria. Thank you very much, sir. And I want to say to everyone, we can be found at Menopause Diva on Facebook and Instagram. And then we also have a support group, a support network. That helps a lot when you are in a support group. And I'm sure the doctor can confirm that when you have a place where you're vulnerable, you can talk about what you're going through and other people can tell you what they did. That's how I got to know a lot more about HRT from some members of the support network who also are on HRT. Thank you so much. So we look forward to your comments. We're grateful to you, sir, and we hope we can talk to you again another time. We shall be seeing you soon.
Okay.
Thank you very much. Everyone, we have to go. We plan for this to end at 2 and it's 2:15. I hope you have enjoyed the session and we look forward to having another menopause conversation. We're not sure when that will be now, but when we have it, we'll put it on our Instagram and Facebook handles. God bless you. God bless you, sir. Have a good day. Thank you.
Bye-bye.
Bye-bye. Thank you.